Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Wednesday, August 11th, 2021. And our top story today, tips for improving yours and your family and friends' mental health. Well, joining me now to discuss this and a lot more is Dr. Netta Gould. She's Assistant Professor of Psychiatry and Behavioral Sciences at Johns Hopkins Medicine. Netta, it's great to see you. Thanks so much for joining us on the program this morning.
Thank you so much for having me, Jeffrey.
Yeah, this is a really important topic, and so much of what we're hearing in the news, the mainstream news, is around mental health. And I guess my first question to you is, how has mental health changed from your perspective in the last 18 to 24 months?
Yeah, it's a really important question. I think it's changed substantially, and not, unfortunately, in a good way. I think we've seen increases in anxiety and depression, stress-related disorders. We've seen increase in substance use and misuse, people considering suicide. And just to kind of give you some perspective, so before the pandemic, we were looking at maybe 1 in 10 U.S. adults reporting anxiety, depressive symptoms, and now it's more along the lines of 4 in 10 adults. So there have been substantial increases in issues, mental health issues.
Yeah, and that obviously very unfortunate. We've got challenges. We'll talk about dealing with this and treating with this in a minute. But outside of the pandemic, are there direct causes for this massive change? I would consider it to be a massive change. I mean, going up, not down, not a good sign. Is it the loneliness, the isolation from the pandemic, or is it more the financial stress, the anxiety of all the societal pressures that we all face every day, and how we manage that?
Yeah, I think that you hit the nails on the head. So I think that loss of social support and isolation, and then the financial difficulties are major ones. The strain that the pandemic has put on families, travel restrictions, people fearing contracting COVID still, and generally just this sense of unpredictability and uncertainty, which is very challenging for us to deal with.
Yeah, no one, including the stock market, likes uncertainty. Everyone likes certainty in their lives in terms of routine. When you look at the types of individuals that are maybe more significantly impacted than others, are there examples of groups, for example, maybe more mature Americans who may be a little bit more susceptible to or are a lot more susceptible to the virus? Are there other groups that you have seen where the numbers have ticked up? Maybe in an overweight to that group?
Yeah, I think, very few people I feel like have kind of gotten through this pandemic completely unscathed. But, the more vulnerable groups, I would say children and young adults, minorities, of course, essential workers, such as healthcare workers, people who've actually experienced job loss, and then the kind of pre-existing vulnerable individuals in terms of psychiatric issues. So individuals who had pre-existing psychiatric conditions are, of course, more vulnerable to have exacerbated symptoms during this time.
And we saw a lot of governmental support, I think stimulus, however you want to, whether it's stimulus or not, transfer payments, helping people out. Have you seen an increase in governmental services around mental health? Because, as you said, there are certainly different groups being affected differently, some of whom may need reliance on government to help them out. But are we seeing more government services stepping up?
I think that, yes, the government certainly is trying. This is an issue where we had difficulty with access to mental health care for people before the pandemic. So it's very challenging, I think, to all of a sudden revamp the systems that were in place. But I was reading like SAMHSA, the Substance Abuse and Mental Health Services Administration, recently awarded, I think, $250 million in grants just to increase access to substance use disorder and mental health treatment services. So I think that they recognize how broad of an issue this is that needs to be addressed, and they're working to get this addressed.
And are individuals being more open about their mental health? And we've seen a lot of high-profile athletes, Olympic athletes, football athletes of all time, really say, hey, I'm going to take a break here. I'm having some mental difficulties in terms of how I'm dealing with certain issues. Are people being more open about this in terms of your practice and what you're seeing from patients? Whereas before, when I was growing up, you kind of, being open about some of your mental health issues maybe was not as widely received as it is today. I think people are a little bit more heralded. But are you seeing that within your practice and some of the patients that you're working with?
Yeah, I am. And, if there's a silver lining to some of these, looking at this pandemic from the mental health perspective, I would say that, yes, there's a decrease in the stigma associated with having mental health issues. I love that the celebrities and people in leadership roles are coming forward and saying, my mental health is important. I think that's such a big step in the right direction. And so I do think that people are being more open about their mental health issues because they need the help. They also recognize that they're not alone. And I'm hoping they continue to recognize that they're not alone.
Yeah, it's really important, obviously, to prevent the extremes like substance abuse and even the risk of suicide, and so making sure that we're preventing people from taking their lives for what may be something that's really solvable if you just have a conversation. I guess the last question for this segment: employers. There are all different types of employers all across the economy, whether they're private sector, not-for-profit, governmental, higher ed, you name it. Are they being more receptive to their employees' mental health needs in addition to their physical health needs?
Yes, based on what I'm seeing, they are, and I think it's a wonderful step forward. So I've seen it in my organization, seen it in other organizations. The employers are really recognizing that we don't have an alternative. This is something that we have to address and make resources available because it's impacting productivity. It's impacting people staying in some workforces. So I'm really happy to see how many employers have stepped up to assist the employees.
Yeah, I guess anecdotally, I've seen a lot of different culture changes where, it used to be a very, curt response. If someone wasn't doing their job for whatever reason, the employers were more apt to let you go. But I think when you look at the financial impact of having to retrain an individual and, you want continuity, whether you're a manufacturer or a football team like the Baltimore Ravens, your and my team. You want that continuity to make sure that you're able to deliver services to your customers. So investing heavily in overall well-being and mental health seems to be a better approach, I would say, instead of that curt, okay, we're done with you, let's move on.
Absolutely. So I hope that this is something positive that comes out of the pandemic when it's so difficult to look for positive things that are coming out of this past year.
Yeah, sorry to interrupt you. I was going to just add that I think there are a lot of lessons to be learned, a lot of pain and suffering, but I think out of that, as a society, as a country, as a world, we're going to figure out a lot more solutions, I think, to some of these ills. Ned, I need to take a very quick break. When we come back, we'll talk about tips for prevention and treatment of mental health disorders and issues. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? They are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Dr. Netta Gould of Johns Hopkins Medicine. Netta, thanks so much for staying with us this morning.
Thank you so much, Jeffrey.
Yeah, I'm glad we're able to highlight this. This is a very important issue for so many of us. And I guess let's start the second segment out with what can we do as friends, family members, employers, people that are around people who may be showing signs of mental health challenges?
Yeah, I think the first thing is to just, if you feel comfortable, reach out and ask how they're doing. And also sharing your experiences, that can be really powerful as well, so that people recognize that they're not alone. I think mental health issues can feel so isolating, but if you can talk to others and start an open dialogue, that's really important. I think in people, your loved ones, family members, friends, acquaintances, also just looking out for warning signs. So withdrawal, hopelessness, feelings of low self-worth, that life isn't worth living, and just a general change from the person you used to know. If there's a significant change, that's when we want to think about intervening.
And let's be clear, we all, every single one of us, go through some level of anxiety, and we manage our anxiety different. Some of us work out, some of us eat, some of us unfortunately may drink or smoke or do drugs. But we all have anxiety at different parts of our lives. So this is not an uncommon malady for all of us. And so being able to address and look at the warning signs and see it in our friends and family, that's a big part of the extreme, which is suicide and other horrific endings that people may pursue.
Absolutely. I think that's a really excellent point that, I don't know anyone who hasn't experienced some anxiety or a low mood during this period of time or at some point during their lives. They are really normal reactions to stressful circumstances. But what we want to look for, significant impairments in functioning or the ability to enjoy life.
Yeah, and psychotherapy, again, going back to that stigma talk that we were talking about, I think that is so passé. More and more people going to have conversations with people like yourself, a clinical psychologist or a psychiatrist. How important is that to go to someone with your skill set, to sit down and talk about your problems, maybe be diagnosed, and also come up with a treatment plan?
Yeah, I think it depends on the circumstances. So I think it's important to have some form of support as a starting point. So it might be that you start talking to a family member, a friend, or a colleague, maybe your primary care doctor, maybe you call a local or national hotline. And for some people, that's enough. I think if the symptoms, as I mentioned, are prolonged and impairing, then I think it's helpful to speak to a mental health professional, get evaluated, and get treatment.
When you think about these discussions, just to kind of give the audience, maybe for those who have not gone to speak to somebody about their mental health, how do they generally work? Are they done in confidentiality, privacy? Does insurance sorry, I'm hitting you with a lot of questions, but does insurance generally cover like a psychotherapy session?
Yeah, those are great questions because it is not easy to first take that first step to seek mental health care and also to know where to go. I think it's some avenues. One is to talk to your primary care doctor and they can make a referral. You can call your insurance, and that's a sure way to be able to find someone who's in network who accepts your insurance. Otherwise, if you do a Google search and find someone in the community, that is a way to go, but you're not they're not necessarily going to accept insurance. Psychology Today, for example, is a website where lots of mental health therapists will post summaries and also mention the insurance that they accept. And so what would happen is you'd call if they're taking new patients, schedule an appointment, and it's not always the best fit with the first person. So don't be disappointed if you meet with someone and you think, oh, this isn't going to help. You do need to sometimes try a couple of people, and that's okay. But just as much as they're interviewing you in terms of your psychological health, you can interview them in terms of whether it's a good fit for you.
Absolutely. I was going to ask you about that because, we all have different needs and we all relate to people differently. And so what might work for somebody, for example, my wife, may not work for me and vice versa. And so, but every time you interact with a professional, a clinical professional, I think you get benefit from it. So even if it's someone that you're not going to stick with long term, they take very detailed notes, I would think, and those notes could be available just like your primary care doctor. If you decide that you leave your location, I left New York, went to Charlotte, I took my notes with me and can give it to my primary physician here. So it's all transferable.
It is, and I think the point you brought up about confidentiality, the notes, just like your primary care notes are confidential, and so you're not going to have all of your employers or colleagues seeing your notes by any means. There are just a few instances where a psychologist or mental health professional has to break that confidentiality, and that's if you're at risk of suicide, if the records are subpoenaed in some ways. So otherwise, the notes are really confidential.
Yeah, and that's just a reminder. It's not going to fall into the hands of an employer, a spouse, anyone. It really is for you to feel safe and able to share. I guess last question here, Netta, and I know you are a psychologist, but how important are medication treatments? Excuse me. We see the ads on TV. We read about them in brochures and whatnot. We hear about it at the doctor's office. How important can those be to a prescribed treatment plan?
Yeah, they can be very important depending on the circumstances. For some people, psychotherapy may be enough. For some people, just the medication is enough just to give them a boost to engage in activities again. For more moderate to severe cases of mental health issues, generally some combination of those two is helpful, psychotherapy and medication.
Yeah, really good information. Certainly ask your doctor, medical professional about that before taking anything. Don't just borrow it from a friend. Probably not a good course of action. Netta, we're going to have to leave it there. Really great talking with you. This is an important topic. It's at the right time that we talk about this, and I'm so glad to have you on. I hope you come back again very soon.
Thank you so much, Jeffrey. Lovely to be here.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the information in retirement, markets, technology, personal finance, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. We're back again tomorrow. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a tax doctor now for a tax emergency analysis.
Call 800-224-6439.